Medicare. These are the five ways in which you can get Medicare. Now, the more common one is up at the top.
Okay, if you've been getting a Social Security check from us, you're pretty much automatically in the queue. So a couple months before you hit 65, you'll end up getting a red, white, and blue health insurance card in the mail. Okay. If you've been disabled for 24 months, you end up getting it. If you have ALS or Lou Gehrig's disease, you can get it. And again, you know, I'm talking to you generally because this could be applicable, maybe not to you, but it could be to somebody in your family. Okay, somebody that you know, someone who's not aware of these things. Kidney dialysis, maintenance, permanent kidney failure can get exposure to environmental health hazards. Now, I'm going to come back to the slide in a second. Medicare has 4 parts. There's a Part A, Part B, Part C, and a Part D. I'm going to work my way back real quick. Okay, the Medicare Part D with the prescription drug coverage. Okay, my understanding is if your employer has a Medicare prescription drug coverage benefit that's better than what we offer, you do not have to take it. The Medicare Part C are what are called the Medicare Advantage plans. These we do not get involved in because these are these outside insurances because Medicare doesn't cover everything. So these could be like Blue Cross, Blue Shield, Anthem, Travelers, AARP. And some of them can be expensive. But the more common ones you're going to deal with are going to be the Part A and the Part B. Okay? The Part A, you will get that free based upon the fact that you worked and you paid into Social Security. Okay? And for those of you who may have not worked long enough in Social Security, but you're married and your spouse did pay Social Security, you can piggyback onto your wife or your spouse's record to get Medicare. Okay, even though you didn't pay into it. Okay, so you can get the Medicare on a spouse's record. And again, this again comes to you free. Like most places, you have a deductible. Then with the Medicare Part B, if you're getting a monthly premium, if you're getting a monthly check from us, okay, for Part B, there's a monthly premium, which right now is $104.90. Because we did not have a cost of living adjustment for 2016, everyone who's already receiving a benefit right now from Medicare last year, you're gonna pay the same premium as everybody else. You're gonna still pay $104.90.
Anybody who's knocking on our door right now is going to pay a higher premium, which is $121.90. Some of you may be paying a higher Medicare.
That's just new people?
This is just new people. Anybody who's coming on in 2016.
Based on the 104.90?
Yeah, everyone from 2015 and prior is at $104.90. Anybody who new is coming in right now is going to be $121.80.
Some of you may be paying a higher premium, Medicare premium amount. The reason for that is because of what's called the income-related Medicare adjustment. This is something that was set up by the IRS, not by us. So depending upon what your overall adjusted gross income is, IRS looks at that and says, okay, you may have to pay a higher Medicare premium compared to everybody else. It's all based upon what income is. If you have a change, you notify us.
We only get involved with signing you up. We have nothing to do with, okay, my prescriptions weren't covered or I was in a facility. This is who you have to basically take and call.
Affordable Care Act, again, this may or may not be applicable to you, but some people may fall into this category. We ask them to take it, sign up, visit our website at healthcare.gov. Again, we take fraud seriously. If you know somebody has a bad back and they're getting Social Security, but you see them, you know, lifting refrigerators and stuff, call us up. You know, let us know. Some people, we've found people who are committing fraud, unfortunately.
Again, you know, we really just offer so many things online, and maybe some of you are hesitant about going online, and some of you, but you may have a son or daughter who's very tech savvy, okay? Who him or her can kind of guide you. Nowadays, you got kindergartners who know how to work these things, okay? Any questions? Yes, Rob.
Medicare.
Medicare, yes.
Spouse.
Spouse.
Whether you're older or younger or vice versa, you have to sign up for Medicare at 65. Your spouse is 10 years older than you. Okay? You're 55, she turns 65, and she's never worked to pay into Social Security. Is she eligible for Medicare?
No.
Okay. Now, is she eligible if you have the 40 quarters? Or not till you're 62? That's what I was told when I had this situation. In other words, when I was 60, my wife was 65. They told her she couldn't get Social Security, so the town continued to cover her on medical.
Until you reach age 62.
Till I reached 62.
Correct.
And then she was able to put in for Medicare.
Correct. 62 pretty much is the base.
62.
62. So if your wife is older than you, never paid into Social Security, now she applies it for Medicare, but she doesn't have the work, she will not get it. But once you hit 62, she can now jump on yours.
I just want.
And it has no impact. It doesn't take anything. You just sign her up for the Medicare based on the fact that she's a spouse under your record and you paid into it. Yes.
Well, thank you. I'll stick around if you have any questions, and please come up and grab some materials. Thank you.
Thank you.
If everyone wants to stretch for a couple of minutes before Karen speaks to you.
Thank you.